Okay, half a day, everyone. It's 9 o'clock in the morning, Saturday time. Good morning. My name is Glynis Almonte, the Secretary of the Guam Diabetes Association. Thank you all for joining us today in our first virtual diabetes conference. In the past, we are inside the Hilton Hotel for the full day conference, but due to the pandemic, we are just seeing each other in a small screen via Zoom. We are happy that there are more than 150 registered participants for this conference. Right now, we have about half. Hopefully, they can all join us. The theme for this year is Managing Diabetes Through the Pandemic. This conference is sponsored by the Guam Diabetes Association in partnership with the Guam Diabetes Control Coalition, the Department of Public Health and Social Services Diabetes Prevention Program, and the Mountain Pacific Quality Health. We have some Zoom instructions during this conference. Please mute your microphones during presentation, except the panelists and the presenters when they are speaking. This presentation will be recorded and will be sent to you through your emails. You will also receive certificates of attendance that will be sent to your email. If you have questions, please type them in the chat box and we will read them at the end of the presentations and the presenters will respond to your questions. You can also share your experiences with this group in the chat box. Lastly, please be kind, be patient, and be ready to help others. Thank you. Ladies and gentlemen, let us listen to some welcome remarks. The first welcome remarks will come from Mr. Scott Duenas, the President of the Guam Diabetes Association. Mr. Scott.
Thank you, Glennis. Good morning and half a day. As President of the Guam Diabetes Association, it is an honor and with great pleasure to welcome all of you to our 2020 Guam Diabetes Association Zoom conference. GDA, in collaboration, as aforementioned by Glennis, Guam Nurses Association, the Government of Guam Department of Public Health and Social Service, Mountain Pacific Quality Health, and the Guam Diabetes Control Coalition are making this conference possible. Managing diabetes through pandemic is a timely theme as we deal with this dreaded virus. We are very thankful for the technical leadership of Mountain Pacific Webinar 500 in making this conference a reality. The COVID-19 with other underlying health issues and the complication with diabetes is a very serious negative factor in the recovery from this health condition. Preventing and managing the diabetes disease is very important in minimizing the coronavirus effect. On behalf of our Executive Director, Winnie Butler, Board of Directors, officers, we would like to express our sincere thanks and appreciation to the Guam business community for their continued financial support in our effort to educate and remind our island residents of the seriousness of this diabetes disease. It is also imperative that we prevent the spreading of the coronavirus by wearing the mask, washing our hands often, and observing social distancing. Again, I welcome you to this conference, and I'm hoping that everybody stay safe, and have a good day. Back to you, guys.
Thank you, Scott. Now I'd like to call on Agnes White, a registered nurse, and she's a certified diabetes educator and the vice chairperson of the Guam Diabetes Control Coalition. Aggie?
Good morning, everyone. Buenos and half a day. Welcome to our first virtual conference, but the 21st Annual Diabetes Conference. We have a great lineup for you. We have lots of interesting speakers, experts in their field. And it is our hope that you leave this conference not only learning much, but with a sense of hope and confidence in your ability to manage your diabetes and lead productive lives in spite of having diabetes. So please enjoy yourselves and don't forget to do the evaluation at the end. Thank you very much.
Thank you, Aggie. The last but not the least is Mary Erickson. Mary is a registered nurse and the program director of the Task Order 1 of Mountain Pacific Quality Health. Mary?
Hello, everybody. Thank you, Glynis. I'm calling in from cold and snowy Montana, and I can't tell you how much I wish I was there on your island right now. So I'm just so happy that we were able to help Glynis and Agnes and the coalition put this event together today. I'm excited to hear the presenters and all of the information that you have to share. So thank you so much for spending your time with us this morning, and have a great conference. And I'll be here if you have questions for me. But take it away, gals. And I'm just really proud of Glynis and Agnes and their willingness to put this together and all the effort they put in coordinating everything. So nice work, and I'm looking forward to hearing the speakers.
Thank you too, Mary. Agnes and I are both staff, part-time staff of Mountain Pacific, and we really appreciate Mary Erickson for her help and her team, and Mountain Pacific, of course, for giving us all the technical help. Thank you once again, Mary. And now let us go to the first presentation. Our first presenter is Dr. Mila Young. Melliza Young was born and raised in the Philippines. She earned a Doctor of Medicine degree from the University of Santo Tomas, and she currently holds a Philippine physician license. She earned her Master of Science in Global Health from Northwestern University in Chicago, Illinois. She is a certified diabetes care and education specialist with the Certification Board for Diabetes Care and Education. She currently serves as the manager of the outpatient specialty care at Guam Regional Medical City. Bilay, as we fondly call her, is the lead of the data team of the Guam Diabetes Control Coalition. And she's a member of the different research groups here in Guam. A Cancer Coalition, also the Brief Tobacco Intervention Program, and she's a master trainer for Chronic Disease Self-Management Program. Milay also provides technical assistance to the Pacific Chronic Disease Council. This is a coalition of diabetes programs throughout the US affiliated Pacific Islands in developing diabetes self-management, education, and support. Milay's topic is diabetes management in a pandemic, championing care and support. Please welcome Dr. Melliza Young.
Thank you, Glynis, for that introduction. Let me start sharing my screen and let me know if everyone is able to see it. Okay, give me a few moments. Okay, how about that?
Yes, we can see it. Thank you.
Okay, so thank you everyone for joining us today. And I do hope that you will have some great takeaways from all of the presentations. And I'm sure the other presenters have prepared so many interesting things that we can all learn to manage diabetes through the pandemic. So my topic for today is championing care for people with diabetes during and beyond COVID-19. I hope by the end of this presentation that you'll have, we'll be able to discuss a brief overview of COVID-19 and identify areas of diabetes care and self-management affected by the pandemic response efforts. And we'll go over some ways that to champion diabetes care and self-management during and beyond COVID-19 pandemic. I would also like to remind the audience that every effort was made to ensure that information is current at the time of the preparing the slides for today's presentation, and references are listed at each slide if you'd be interested to learn more about the topic. And we also have a copy of the presentation that can be shared to you at the end of today's conference. So going through the overview of COVID. So when we say COVID-19, so it means coronavirus disease 2019, also known as SARS-CoV-2, which is a form, which is from a family of coronaviruses that has distinctive spikes and giving it an appearance of the solar corona. Now, the coronaviruses are large envelope type of viruses found in humans and other mammals. And through natural genetic recombination and variation, the coronaviruses can adapt to and infect different hosts. And for this particular coronavirus, bats are thought to be natural reservoir, but it has been suggested that humans became infected with SARS-CoV-2 via an intermediate host, such as the pangolin. Now, since the virus was discovered, what do we know about its manner of spread? So coronaviruses are spread through droplets expelled by coughing, sneezing, talking, even laughing or singing during close contacts and face-to-face contact, or when a person touches a surface or object that has active virus particles on it and then touches their mouth, nose, or eyes. And a person is considered exposed to the virus when they have been within 6 feet for a total of 15 minutes or more to an infected individual or to individuals who are symptomatic. Now, brief exposures to asymptomatic contacts are less likely to result in transmission. Now, certain situations such as travel or attending large social gatherings are also linked to higher risk for transmission. Now, people with COVID-19 have had a wide range of symptoms reported, so ranging from mild symptoms to severe illness. And symptoms may appear from 2 to 14 days after exposure to the virus. And people with the symptoms shown on this slide may have COVID-19. And remember, this list does not include all possible symptoms. Now, the Center for Disease Control and Prevention will contain COVID-19. Now, there are two kinds of tests available. There's what we call a viral or molecular test, which tells you if you have current infection. And there's an antibody test, which will tell you if you had a past infection. Now, as for any other important medical question, when you begin having symptoms or thought to have been exposed to COVID or needing a test for whatever reason, make sure to call your primary doctor to determine which test is right for you. And whether you have you tested positive or negative for COVID-19, you should take preventive measures to protect yourself and others. Now, isolation and quarantine help protect the public by preventing exposure to people who have or may have a contagious disease. Now, when we speak about isolation, it means separating the sick people with a contagious disease from people who are not sick. When we speak about quarantine, it separates and restricts the movement of people who were exposed to the virus to see if later on they will become sick. Now, every day we learn more and more about emerging treatments for COVID. So just earlier this week, the US Food and Drug Administration announced the emergency approval of the drug called bamlanivimab. It's quite a tongue twister. It's approved for the treatment, for outpatient treatment of COVID-19. For those with mild to moderate illness in adult and pediatric patients who have certain medical conditions and are at high risk for progressing to severe COVID-19 and or hospitalization. Now, in the United States, there is not yet a known, an authorized or approved vaccine for preventing COVID, but with the possibility of one or more COVID-19 vaccines becoming available right on their website, which is listed on the screen. So I encourage you to read the key things that you need to know, especially that it is continually updated as additional information becomes available. Now, so let's take our first poll. Perhaps Aggie or Mary or Glynis would be able to help me with this. So our first poll is, are people with diabetes more likely to get COVID-19? So choose yes, no, or if evidence is unclear. We'll give you about a few seconds as more and more of you start to answer, our first poll. So it looks like about 30% has started to vote. Let's see. So we'll give it a few more seconds. About 60% had voted. Okay, so maybe let's end the poll. Okay. Well, I hope you're able to see my screen. So let's share the screen. So our poll results, so are people with diabetes more likely to get COVID-19? About 65% answered yes. 8% answered no, and about 27% answered evidence is unclear. And so what do you guys think? The current COVID-19 really has brought major concerns. There's not enough evidence or not enough data to show whether people with diabetes are more likely to get COVID than the general population. But what we do know is that the problem people with diabetes face is they're more likely to have serious illness if they get COVID-19, not a greater chance of getting the virus. So serious illness is defined as getting hospitalized, getting admitted to the intensive care unit, being placed on mechanical ventilation, or death from COVID-19. So in general, people with diabetes are more likely to have more severe symptoms and complications when infected with any virus. The risk of getting very sick from COVID is likely to be lower if diabetes is well managed. So having heart disease or other complications in addition to diabetes could worsen the chance of getting seriously ill from COVID-19. So like any other viral infections, because remember, more than one condition makes it harder for your body to fight the infection. Thus, the more health conditions someone has, for example, you have diabetes, plus you have hypertension or obesity, so that makes it like 3 or more conditions. It adds to the risk of getting serious illness from COVID-19. Now, the global guidance on confinement measures for the prevention of COVID-19, such as the lockdown or stay-at-home orders, have a particular emphasis on vulnerable populations, which include people with diabetes. So these recommendations are reasonable to avoid the spread of COVID-19 infection, but they are in contradiction with comprehensive diabetes care, which requires regular patient-provider interactions such as patient education, obtaining prescriptions, and possible management of complications or mental health. Now, moreover, confinement drives risk for unhealthy diets, decreased physical activity, mental health related concerns, in parallel to delayed care seeking due to fear of contracting COVID-19. Now, another weakness in the current COVID-19 response is the focus on hospital care, which overlooks the importance of primary care in guaranteeing continuity of care. Ensuring the availability of insulin, other medicines, self-monitoring and diagnostic tools is another area of diabetes care and self-management that's affected by the pandemic response. So these are all global concerns for the diabetes community, as well as for those suffering from other chronic conditions. And when we consider a person with diabetes who has about 3 times the risk of getting serious illness from COVID, and then additionally, because of other factors such as age, race, poverty level, homelessness, what I would like us to do next is, just pause and think about the factors that impact blood glucose or blood sugar. So for example, how does individual attitudes, beliefs, and behaviors affect food intake, medication compliance, or physical activity? And how about family dynamics or living in multi-generational household, wherein the only person that prepares meal for the family is the same person who had to work, say, a 12-hour shift? Or in communities where shipment of medications and essential supplies are delayed because of high demand to move goods via mail or, say, air travel. And imagine how much more challenging it is right now for people with diabetes on Guam to navigate the COVID-19 pandemic where lockdown is in place. So what can we do? All of us, we have multiple layers of influence. So within our own capacity, we can do something and champion care for people with diabetes during and beyond COVID-19. So this illustration considers the complex interplay between individual attitudes, beliefs and behaviors, interpersonal relationships and family dynamics, community level, and societal and policy level. So it allows us to understand that while there is a range of factors that put people at risk for negative health outcome, this model also suggests that in order to achieve better health outcomes, it is necessary to intersect every influence at the same time. So this approach is more likely to sustain efforts over time than a single intervention. So undoubtedly, the global priority is to contain the spread and impact of COVID-19. With so many uncertainties and life sometimes feels like it's on hold for most of us, we have a long road ahead. But health systems will need to meet the needs of the entire population, including people with diabetes. So therefore, in parallel to the pandemic response efforts, there are ways to champion these so that we avoid health consequences that might be worse than the pandemic itself. So let's go over let's go over these like one by one. So first, we can reduce the risk of serious illness from COVID-19. So as an individual or member of household or a community, we can reduce the risk by following the list as stated in here. And I'm glad Mr. Duenas had mentioned this in his welcome message about reminding us on how we can continue to reduce the risk of getting COVID. And I'm not sure if you're all familiar, but there was even a post circulating on social media on a mnemonic about, infection control measure. And I wonder like how many of you have heard about, touching men and instead following women. So let me just show you where I got that. Okay. So one thing I'd like to say here, like credit to the owner. So this is what it simplifies the ways we can reduce risk of, getting COVID. Again, avoid touching your mouth, eyes, and nose, and instead, wash hands, obey social distancing, mask up, exercise and eat well, and no unnecessary traveling. Okay, now in addition to basic COVID-19 screening for symptoms and temperature upon entry, it became a standard protocol in most institutions. So it's not only in healthcare organizations, but when you go to the bank, grocery store, even your mom and pop store, they require us now to wear a mask. In most places, you will also see educational posters on ways to stop the spread of the virus. And on a wider scale, we have local government imposed limits on sizes of gatherings or business capacity, proactive closure of school, workplace, or public transport, and of course the lockdown. Now, internationally, there's border closure or enforced quarantine to inbound travelers. So again, the key priority here is on a population level. You would want to combine measures that minimize societal and economic disruption while adequately controlling infection. Now, so moving on. So the next way that we can champion diabetes care through this pandemic is to prepare for sick days. I mean, this is fairly not common to prepare for sick days. We wouldn't want to think about we're going to get sick in the future, but for people with diabetes, this is one of the essential care to prepare for sick days or to plan in advance of illness, because being sick, it can make it hard to eat, and oftentimes, excuse me, and oftentimes it's hard to do anything at all. It can make blood sugar fluctuate, and the danger really happens when the sugar goes below the normal levels. So again, people with diabetes are familiar with what we call the sick day rules for managing diabetes, and includes checking the blood sugar every 2 to 3 hours or as often as needed, even checking ketones in urine or blood. And important also would be instructions about not stopping their insulin or other diabetes medications, and having what we call a sick day meal plan. Now, here is a great example of a sick plan from the American Diabetes Association. So it incorporates the standard preventive measures with against COVID-19, as well as preparedness plan and traditional sick day recommendations. Now, beyond COVID-19, managing diabetes can again even be harder when you are dealing with, say, a major storm like loss of electricity or possible evacuation from your home, such as when people with diabetes would need to be transferred to an isolation facility. So there is this great resource from the Diabetes Disaster Response Coalition, which created a comprehensive checklist to help you build what we call your diabetes disaster preparedness plan. So building a diabetes kit can save you a lot of worry and time, of course, when disaster strikes. Okay, so moving on to the third way to champion diabetes care is to seek help as often as needed. And this is a way to remind people with diabetes that in this pandemic, they're not alone in their journey. And when someone is diagnosed with diabetes, everything just changes. Their identity, their thoughts, emotions, lifestyle, schedule, and even relationships. So it is normal to feel discouraged from time to time. So learning how to navigate the course of diabetes self-care will help you stay in good health. So family and friends can help you navigate the course of diabetes self-care. So try telling them why you need their help. Like your family and friends may be more supportive if they understand the reason. Sometimes just telling others how you feel helps to relieve some of the stress of diabetes care. Also, connect with people in the community who share your story. So it's important to have a network of people who you can turn to. So bottom line is your diabetes care and education specialist, your provider, and your support systems are there for you. So they can help you problem solve any self-care issues you are having in order to lower stress. Lastly, when you start to feel sick or develop any symptoms requiring emergent care, you still need to go to your doctor or call 911. Now, since the start of COVID-19 containment efforts across the nation and worldwide, there has been a massive drop in the usual number of heart attack and stroke cases showing up at hospitals across the country. And this has actually raised concerns that patients are not seeking medical attention because of fears about going to the hospital, fear of contracting COVID or taking up space in the hospitals. So is it safe to go to the emergency room during the pandemic? Now, hospitals and emergency departments has proactively adjusted, implemented, and changed protocols to ensure the safety of patients and the frontline staff. So you can expect care providers will wear the full personal protective equipment or PPE, including mask, eye protection, and gloves while they care for you. This is on top of the universal masking for all patients, social distancing in waiting rooms, and COVID-19 screening and testing. So it is critical to seek care for any symptoms, including pain and loss of function, that are new and concerning. Although if you're not sure if your symptoms are serious enough for a trip to the emergency room, your primary care provider or if there's a nurse advice hotline would be great resources to connect with. Now, as we continue navigating through this pandemic, more and more resources will become available virtually, and which naturally leads me to the next strategy to champion diabetes care. And that is to make technology work for you. And so nowadays, digital health is everywhere. So we have telehealth or virtual doctor visits, like what we currently have now, which is a virtual meeting or conference. And it seems like it has become the new normal. So if I may share, the first COVID-19 patient in the US was initially treated by a doctor who conversed with him over a video monitor in his isolation room. And so telehealth can actually bring your medical specialist into your living room. And it will be interesting to know, how many of you have actually converted your medical visits into a telehealth? And there is this survey from the University of Michigan National Poll on Healthy Aging. And they asked adults age 50 to 80 about their experiences related to telehealth visits. And they found out that there was a substantial increase in the proportion of older adults who reported that their telehealth, that their healthcare providers offered telehealth visits. So that's like 1 in every 5 adults age 50 to 80 had a telehealth visit during that period. However, there were concerns about telehealth visits among older adults. And one of it is that they felt like the healthcare provider cannot conduct a physical exam and that the quality of care is not as good as in person. Or other concerns were that they were not feeling personally connected to the healthcare provider. They have had difficulty seeing or hearing healthcare providers, and of course, privacy. Now, with the rapid change to provide care without unnecessarily exposing patients to COVID-19 in a healthcare setting, these are valid concerns. So nonetheless, if you know what to expect during a telehealth visit, then you worry less about it. So yes, you can continue with your annual checkup virtually in the safeguards of your home. So most clinics will have a medical assistant or maybe a telehealth technician who will explain the process of virtual visit. So some clinics will encourage the use of a tablet or computer for screen sharing or for teaching. Otherwise, just having a functioning telephone number is enough. When we say functioning telephone, it means it has enough minutes if you're on a prepaid plan or the phone is fully charged. Now, to prepare for a telehealth visit, you need to find a comfortable space without make sure that you don't get interrupted during the visit, and you can bring some notes with you if you want to take notes like during that visit, or write down any questions you have for the healthcare provider. And be ready also to provide your glucose results and your list of medications. And if you have the weighing scale or other self-monitoring devices at home, you can share that information as well. And like what was your home blood pressure or your home weight or pulse, if those are available. And another technology actually that has become more relevant in these times is what we call the continuous glucose monitoring, or CGM. So it is a wearable sensor, as you can see here on the screen. It tracks your blood sugar 24/7 in real time and transmits it to a receiver, which can either be in a separate unit or on your smartphone. Now, this is an FDA approved system that can collect readings automatically every 5 to 15 minutes. It can help detect trends and patterns that give you and your doctor a more complete picture of your diabetes. And in my personal experience, using this device, it's such a powerful tool as it gives you real-time visual glucose data that can influence your lifestyle choices real time. So watching your sugar number increase after a meal or a snack, it really motivates you to get a walk to limit your glucose spike. So that was just the most powerful effect on me. However, it does not completely eliminate finger stick testing, since you still need to validate very high or very low sugar readings. But it definitely reduces the need for frequent poking, which is a real plus to patients who are already on insulin injections. And in the recent past, only insulin users were getting coverage for the CGM. Now we're actually seeing a shift that the non-insulin users can get it covered. Now, so we spoke about ways to reduce risk of illness, preparing for sick day, seek help as often as needed, and make technology work for you. So let's go on to the last way to champion care for people with diabetes, which is to engage in collaborative diabetes care. So once again, diabetes management in patients with COVID poses a great clinical challenge, wherein it requires a much integrated and collaborative team approach. So collaborative teams provide continuous, supportive, and effective care, which are ideal for prevention and management of chronic diseases like diabetes. So the benefits of diabetes care team may include improved sugar management, there's lower risk of diabetes complications, it's a more efficient patient education, and it was also found to increase patient follow-up, decrease healthcare costs, and improve quality of life. Because the individual diabetes care team members are rarely involved in every aspect of patient care. So a flexible plan will help determine the most effective use of team resources, and it also provides the needed flexibility. Now, in short, diabetes care does not have to happen only when you visit your PCP. So in a consensus report from the different specialties, diabetes self-management and support must occur at essentially every health encounter. At the time of diagnosis, when you're not meeting your treatment goals, when complicating factors develop, such as when you visit your eye doctor for vision problems, or even when you visit your foot doctor for a sore, and especially when when changes in life and care occurs, such as the ongoing changes brought about by COVID. Now, to help best manage diabetes, there's what we call the 7 self-care behaviors that every person with diabetes should become very familiar with. And discussing these areas of 7 self-care behaviors with your collaborative diabetes care team can help you to set up an individualized plan and goals. Now, we all know that diabetes is truly a very complex complicated disease. And if a person follows every doctor's order, it takes more than 2 hours actually of your time every day to perform the recommended self-care. It is estimated that patients with newly diagnosed diabetes would take about 25 to 30% longer for all self-care tasks. And older patients with disability could require twice as long for most tasks and might also need the help of a caregiver. So imagine how much more taxing it has become with COVID-19. Nonetheless, despite knowing that there are existing disparities in healthcare along with the challenges presented to us by COVID, or the lockdown having a negative impact on diabetes care and self-management, collectively, we have the power to choose among many ways to stay healthy with diabetes during and beyond the pandemic. So this is my last slide. I would like to thank you all again for your time. And I hope you have some key takeaways from today's presentation. And basically that's it. I would like to go on to like the last two calls we have. So if maybe Glynis or Mary or Aggie would help me with this. So based on the presentation today, if tell us if the presentation increased your knowledge about diabetes care and self-management. So please go ahead and do that. And then there was also another poll about what would be your changes that you would adopt in the next 30 days as a result of your participation in our presentation today on how you can continue to champion ways for diabetes care and self-management. We'll give it a few more seconds. So people are continuing to vote. Thank you so much. And I'd like to ask Mary or Glynis or Aggie if we would like to start going over the questions, if there's any. Okay, so, okay, very good. Thank you again, everyone, for your time today. So we really look forward to hearing more from you on how, again, as together, how we can all champion ways to improve the care of people with diabetes, especially during this time of the pandemic.
Okay. Thank you very much, Dr. Milay. Very enlightening presentation. If you have questions, please type them in the question and answer box, and we will discuss and answer the questions after all the presenters have given their presentations. Yes, you are not alone. There are 125 of us here in this conference, virtual conference right now. There are a lot more in our community. So once again, exercise break. Thank you again, Linda. Now we go to our second presenter. Okay. Our second presenter is Dr. Ann Pobutsky. She is our Territorial Epidemiologist for the Department of Public Health and Social Services. Dr. Ann came back to Guam in November of 2018 after 22 years of being away. She was here from 1979 to 1996, and she worked as a planner in the government of Guam, as well as with the VA and the University of Guam. She worked as an epidemiologist at Oregon Health Sciences University and then the Hawaii State Department of Health, and was a researcher at the University of Hawaii at Manoa. Her research background includes chronic disease epidemiology, social epidemiology, community health needs assessments, and addressing health disparities. Her current work focuses on infectious disease epidemiology in Guam, including addressing COVID-19. Dr. Ann's presentation title is Diabetes and Obesity, Risk Factors for COVID-19 Infection and Mortality on Guam 2020. Welcome, Dr. Ann.
Yes, you want me to start sharing my screen?
Yes, thank you.
Okay. This talk focuses more on mortality. When we first started addressing COVID, we knew that people who are elderly and people with chronic diseases were more at risk for severe outcomes and possibly mortality, but we didn't have a lot of data at that time. We do now have more data, unfortunately, because of the surge in cases that began in August and, of course, the subsequent deaths. So I've been looking for the past several weeks at the death certificate data. As some background, just in case you don't know what the prevalence of diabetes is on Guam, it's ranging from 12 to 14% compared to the US, which has been hovering at about 11%. So Guam has higher rates of diabetes. And this data is based on the Behavioral Risk Factor Surveillance System survey of the CDC. It's an annual survey that's done in all states and territories since the 80s. We also know that diabetes prevalence does increase with age. And on Guam, that's 20% of the population over age from 55 to 64 and 22% among those age over 65. And we do know there are disparities associated with that, including lower education and lower household income associated with diabetes prevalence. And I just recently updated this slide with 2018 data. Again, this is almost 50 years worth of data on the proportion of deaths due to diabetes. And that's been increasing since 1970, as you can see. It's not a 100% beautiful up and down, but the trend line is there. You can see it's been increasing. And we do know, as we know from the beginning of the pandemic, that people with underlying health conditions, especially diabetes, obesity, chronic lung disease, and cardiovascular disease, these people tend to be at higher risk for severe COVID outcomes and mortality. Now, we've been looking at these mortality patterns, especially since the surge in August. There were only 5 deaths between March and July of 2020, and 95% of the deaths that we've had related to COVID have occurred in the past 3 months, August, September, October, and of course now into November. This is from the CDC. On the left side, this is what they're suggesting are the known factors for increased risk for mortality. And on the right side, these might be at risk. They don't have enough data yet. But as you can see, diabetes is up there along with cancer, COPD, heart conditions, et cetera, et cetera. We have also been observing that there's a disproportionate deaths in Chuukese and Filipinos. I know this is a busy slide, but if you look on the far right, that is the proportion of these various ethnic groups in Guam's population. And then we can look at the cases and then the number and proportion deceased. And this is based on data up to only a couple days ago, not all of it. As you can see, it's not quite 6,000. We're almost up to 6,000 cases. I'm basing this on data that is in our system. So what we have complete information that has been put into our system. As you can see, Chuukese represent 7.1% of our population, but 16% of the cases, and 31, almost 1/3 of the deaths. And that's very disproportionate to their proportion in the population. And then with Filipinos and Chamorros, you see it's lower. And among Filipinos, it's slightly higher number of cases and deaths. I don't know why with the Filipinos. With the Chukis, we do know, I know people talk about the term multi-generational household, but a lot of families on Guam, Chamorros, Filipinos, not just Chukis, live in multi-generational households. But we do know with the Chukis and other Micronesian migrant populations on Guam, they live in overcrowded housing and sometimes substandard housing. So I don't know if multi-generational housing or houses is the key variable here, or if it's actually overcrowded housing, which puts people more at risk for the spread of COVID. And we did have, we've seen a couple of, one African-American, we've had one Korean who has died, but again, those numbers are low compared to their proportion in the population overall. So that first number is wrong. It's not 4,628. It's almost 6,000. Of those confirmed cases, as of the other day on the 10th, and when I ran these numbers again, only 357 out of 5,088 who had complete information in our system had diabetes. That's about 8%. That's a little lower than our overall prevalence, but the prevalence estimates come from the BRFSS survey, which it's just adults. This number of cases includes everybody in the population. So that's probably why it's lower. For the deaths, with the complete information we've had as of the other day, 41 out of the 88 cases that had full information had diabetes. That's more than half. Many have also had hypertension, cardiovascular disease, or end-stage renal disease. And we do know that cardiovascular disease is a comorbidity with diabetes, because diabetes tends to mess up people's circulatory system. And then if you have additional risk factors like hypertension, that also increases your risk. And this number of the proportion of people with diabetes who also died of COVID has hovered at about 1/2 of all deaths, especially in the last 3 months. Sometimes it goes to like 48%, sometimes it goes to 52%, but the pattern is that we're seeing about 1/2 of all the deaths are associated with also a diagnosis with diabetes. An additional risk factor, of course, is age. As you can see from this, another busy table, that the cases among those over 40, it's about 1/3 of the cases are those over 40, but it represents 42% of the deaths. And for those over 60, while it might be about 12% of the cases are people over 60, it's 54% of the deaths. So old age is definitely a risk factor because we become more frail as we get older. And males are more likely to be comprised of both cases and deaths at 56%. So it's slightly higher among males overall, both cases and deaths. And what I did for this analysis of the death certificates and the other information that we've got is we looked at death certificates. As of the other day, we had 91 deaths. I know it's 92. We don't have information. There's always a lag time before we get information from death certificates. It usually takes a couple weeks to get the death certificate. So we have death certificate data on 73 cases. We have MD notes on 46, and we have information from the line list, that is the forms used for the COVID testing, on 59. So complete information means any information we got from any of those sources where there's a diabetes diagnosis, or it's listed on the death certificate, or the MD at the hospital has made note of diabetes diagnosis. We're also planning to include this mortality data in the weekly surveillance report once we get that rolling sometime soon. We've been talking about it for weeks, but it's taking time to get that put together with our data team. And this is another busy table, and I'm sorry, but what I've basically done is summarize where there was the immediate cause of death and the reasons behind that, and then the underlying cause of death, the contributory causes of death, and then what we found from the chronic conditions that were listed in the line notes or the MD notes or the line list, sorry. And as you can see from the top line, most people, the immediate cause of death is a kind of a respiratory immediate cause of death. Usually the doctors are putting acute respiratory failure due to COVID, and that's more than half. And again, you can have more than one cause of death. You can have numerous. In one case, we had 8 or 9 different causes of death in those various categories. And then some, we're seeing heart attacks and strokes. And we've also seen at least 4 cases where the doctor has listed diabetes or its complication as an immediate cause of death. And of course, end-stage renal disease. And then for the underlying causes, it's mainly respiratory again, and then complications of COVID infection. And then for a contributory cause of death, we're seeing a lot of, that's where we're seeing the diabetes and the hypertension. And if you look at the far right, that's where we're seeing the diagnosis of diabetes on the doctor's notes. And that's where we're getting our numbers for hypertension, diabetes, cardiovascular disease. And you see it's higher because sometimes the doctors do not list diabetes as an actual cause of death. If there's just a few, but it's definitely a contributory cause of death. And it's certainly a diagnosis in more than half of the cases. We've also seen some cancer and chronic lung disease. If you remember the earlier slide where they talk about risk factors, but the pattern that we're seeing and the reason I've been dialoguing with the Guam Diabetes Coalition is because the pattern we're seeing is this diabetes, hypertension, repeatedly, this pattern keeps repeating itself in the deaths. And it's definitely a risk factor for mortality due to COVID. And by the way, all of these people have confirmed COVID positive tests. So to summarize, people are dying of respiratory diseases as an immediate or underlying cause of death. People are also dying of cardiovascular diseases or events as an immediate or contributory cause of death. And people are dying of complications of COVID-19, mainly as underlying causes of death. So again, the pattern that we're seeing, the biggest risk factors are diabetes and hypertension and or cardiovascular conditions, as well as renal, kidney failure comes up a lot, end-stage renal disease comes up a lot. Maybe it's about 1/4 to 1/3 of the deaths. And contrary to what they're finding in the US, we're not seeing as much dementia. We had 3 with dementia. We had 1 who had a chronic lung illness mentioned on the death certificate and 7 on the MD notes. And only a few of the MDs are writing in morbid obesity. They have written on 5 of the death certificates morbid obesity and a couple in the notes, but they're really not looking for that, even though I've asked for it from the hospital. There's not as much on tobacco, either on the MD notes or the death certificate or the DPHSS forms. I don't know if people are not admitting to being current or former smokers, or it's just not being written, it's not being seen as a contributory factor. And sometimes we aren't getting full information. At one point when there was an overwhelming number of deaths, some of the MDs filling out the death certificate are just writing in ARDS due to COVID. We had about 10 of the 90 cases, that's all they listed. Maybe they were overwhelmed at the hospital, but that's not helpful to us for our analysis. We prefer more detail, and that's something we just need to work with the MDs on. They're getting a little better now that they're not as overwhelmed. They're writing in more details on the death certificate. And I guess the biggest takeaway from the data is that having this combination of data, not just from the death certificate, but from the doctor's notes and the forms where people list the chronic conditions they have, has been really helpful for giving us a bigger picture of what's really going on. That's it.
Thank you very much, Dr. Ansius Maasi. Thank you for reminding us that chronic diseases such as especially diabetes, CKD, hypertension, and obesity are really very serious diseases that can make us very, very ill, especially during this pandemic. Thank you again, Dr. Ann. Okay, this is Dr. Keith Horinouchi. Dr. Horinouchi practices nutrition and functional medicine on Guam since 1996 at Dr. Horinouchi Wellness Clinic in Tamuning. His specialty is in helping patients improve their health through assessing the root cause of the problems, including assessing nutritional deficiencies, hormonal imbalances, digestion, nutrigenomics, and toxic exposures, and then applying lifestyle and nutritional recommendations. He previously was director of the Guam Seventh-day Adventist Wellness Center and also administrator for both the Kona Community Hospital and the Kauai Veterans Memorial Hospital in Hawaii. He was also the director of Health Promotion, Indian Health in California. Dr. Horinouchi graduated with a Doctor of Public Health in Preventive Care and a Master's of Public Health from Loma Linda University and Bachelor of Science in Psychology. He is a certified nutrition specialist with the American College of Nutrition, SCOPE, certified in obesity, and licensed nutritionist on Guam. He's also the chairperson of the Guam Diabetes Control Coalition. Dr. Keith's topic for today is inflammation, diabetes, and COVID-19. Welcome, Dr. Horinouchi.
Welcome, Doctor. Thank you for taking time off to join us.
It's my pleasure to be here today. And let's see, where do I go to share my screen? Here we go. So I'm excited that I'm able to share from my viewpoint as a nutritionist, somebody who practices nutrition and functional medicine. We've been learning from the great speakers previously on some of the conditions that are higher risk for death and sickness from the COVID. But I'd like to share a little bit of information regarding what are some things that we can do in terms of our lifestyle and nutrition. I think this is one message that needs to go out further rather than just waiting for the effect of the virus. So there's a lot of things, there's more information that's being researched and published. So I would like to just share some of the preliminary information that things that we can do with nutrition. And I'm coming from the viewpoint of my practice, which really is looking for the root cause of the problems. And several of the issues that we have been discussing, of course, relate to like our immune system. There's information about inflammation, how this is impacted by diabetes, since we're here regarding diabetes. So there's a few studies looking at some of the mortality related to comorbidities, since we hear about comorbidities all the time. When somebody passes away from the virus, we hear about comorbidities. But what are these comorbidities, and what are some of the risk factors related to some of those comorbidities? So this one study looked at around 31,000 records from January 2020 to May 26 for from 24 different health organizations in the United States. And they found that the number one comorbidity was chronic pulmonary disease. And we just also heard from the previous speaker talking about that. From this study, they found that number two was diabetes at 15%. So as we're looking at all the data, of course, we're seeing that diabetes is a very significant risk factor for getting very sick or even dying from this virus. Another study this one here was an analysis of a number of different studies put together, kind of a review of studies. And on top of their list was obesity at 42%. Now, let's see. Hypertension was second, 40%, and followed by diabetes, cardiovascular, and respiratory disease. And this journal article from Dr. Mehta and others in the Lancet journal in March of 2020. The title is COVID-19, Consider Cytokine Storm Syndrome and Immunosuppression. So what they're saying here is that suggesting that patients may have a hyperinflammation response with this COVID-19 virus. And so if it's inflammation, then this is one thing that we need to consider in terms of prevention, managing our diseases better so that we don't succumb to this possible storm of inflammation. So a couple of facts about diabetes. The first fact there is that high or uncontrolled blood sugars cause a dysfunction of the immune system. So we already know with diabetes, it's not just having diabetes that is going to increase your risk for having increased mortality. We want to control the blood sugars. It's very, very critical because we know that the high blood sugars will have a suppression to your immune system. And then of course, an increased susceptibility to the virus. And we're also looking at the future too. Probably this is not the only virus. So in managing the diabetes, we need to look forward. You know, what can we do to boost our immune system even beyond COVID-19? We need to look at the future that we're having a different type of health challenges, and our lifestyle and controlling our diabetes is very critical. The second fact there is that insulin resistance increases. I need to move something here. Yeah, so insulin resistance increases body inflammation. And so diabetes is a condition that we also term insulin resistance. Now, even pre-diabetes is insulin resistance. So we're also looking at individuals who maybe don't have diabetes yet, have not been diagnosed, but there still can be inflammation because of the pre-diabetes. So from a lifestyle viewpoint and a nutrition viewpoint, I like to share 3 different areas that all of us can look at in terms of how do we reduce the inflammation that could compound the virus. So in nutrition, the importance of your intake of fats is critical. The types of fats that we eat can increase or decrease inflammation. And we'll take a look at that in a bit. The second thing that can increase inflammation is high insulin. So the insulin resistance is a situation in which the body is producing additional insulin, and that in itself is a factor that increases inflammation with those with insulin resistance or with diabetes. And then also obesity. As we've seen, obesity is up there in terms of higher risks for mortality. Is one of the reasons increased inflammation? Possibly. So looking at the effects of the dietary fat, there's 2 columns here. At the top is what they call omega-6 family of fatty acids or fats. And for all of us, this basically means the fats that come from the vegetables or vegetable oils. And the right column is your omega-3 fats. I think everybody's familiar with omega-3 fats that typically we think of as fish oils. So starting with the omega-6, most of us consume what we call linoleic acid. That is the specific name for the fat that we find in soybean oil, corn oil, canola oil, etc. And then your body converts this to the green box there, which is the gamma-linolenic acid. And we can also get that in our diet through oils like evening primrose oil, borage oil, and other types of oils. And then if you follow the arrow, it can go all the way down to the bottom right, where it produces chemicals that are anti-inflammatory. So when we have a certain amount of these fats, preferably from the whole food, then the body can make these anti-inflammatory products. But the arrow on the left going down to arachidonic acid, which is also the same as the fats that we find in meats, which are mostly saturated fats. This can turn into pro-inflammatory products, such as the cytokines that we're talking about. Now, the main issue there and the American diet is that we have too much vegetable fats. Everything is fried, everything is deep fried, chips, French fries, fried chicken, et cetera, So a little bit of vegetable fats are healthy for us, but when we overdo it, like the American diet, then it turns into an inflammatory fat. Now on the right side, I think most people are pretty familiar with the omega-3s. So the orange box there is what we call the alpha-linolenic acid that comes from like flaxseed, hemp seeds, chia. So a lot of you are taking these as ways to try to be healthier. This is a precursor to the omega-3s that we think of like the fish oils, EPA. And then EPA can be converted into DHA. And then those are anti-inflammatory. So the problem with our American diet, including diabetics, probably is we're not getting enough omega-3s and we have too much omega-6. So in other words, we're creating a lot of cytokines, prostaglandins that are inflammatory. So that just adds fuel for the fire. Now you see that one other thing on this slide is that the EPA, fish oils, also help to block those vegetable oils from becoming inflammatory. So reduce your fried foods from vegetable oils and increase your omega-3s. That's my first practical recommendation. Now, insulin. This chart here is showing that when the body produces low amounts of insulin, which is the bottom part of the chart, you're going to have a higher breakdown of fats. So that green arrow shows low levels of insulin promote fat breakdown for energy generation. So that's where we should be. But as you move the insulin to the right, so as your body produces more insulin because of insulin resistance, diabetes, and by the way, most type 2 diabetics have a high level of blood insulin, not a low level. And it's because their high levels of insulin is from what we call the insulin resistance. So the body's trying to compensate for the inefficiencies of how the insulin is working. So when you have more insulin, you're going to promote fat production. And of course, we saw that obesity increases inflammation. Obesity is one of the major risk factors for the mortality in the COVID, et cetera, et cetera. Of course, we all want to lose weight, but in my practice, I've been seeing a lot of people, including myself, gaining weight because of a COVID diet. But we have to be careful. Be careful of the carbohydrates that increase our insulin. Dr. Mehta's journal article talks about the cytokine storm. And they go into how this is affecting our immune system. And they start talking about, well, what are things that we can do? What are some natural things? And so in the area of nutrition, which is my specialty, what can we do in your diet, in your intake of nutritional supplements? And so these are some of the things that are being studied, that are being promoted, things that we can do that is not going to hurt you, but maybe can help you. So the first one there is curcumin. Curcumin is a possible cytokine inhibitor. Curcumin comes from the herb turmeric, most of you are familiar with. A teaspoon of turmeric powder has around 200 milligrams of curcumin. But you can also get supplements which have the active ingredient, the curcumin, which may be even more effective. It's one of the most potent natural way of reducing inflammation in the body. Bergamot is another nutrient that comes from the citrus fruit. This can also be from supplements, bergamot supplements. Flavonoids are a very large area of nutrition, which basically is like plants have a lot of different colors, a lot of pigments. These give added health benefits to us, including resveratrol that you may have heard about from the red wine, but it's also in the grapes. So that also can inhibit cytokines. Luteolin from perilla seeds. The picture to the right there is if you're familiar with Japanese foods, shiso leaf right there is the same thing as perilla. And perilla can also be in this, you can get that from the seeds. So there's an active ingredient called luteolin that may also be an inhibitor of cytokines. Other plant-based foods that potentially may influence the enzymes that promote the virus to do more damage may be found in some of these products here. There's a nutrient called camphorol that you might find in spinach, cabbage, dill. Quercetin, found in dill, fennel leaf, onions, oregano, chili peppers. Luteolin, olive leaf, starfruit, curcumin, turmeric. Naringenin, citrus fruits. Oleopian from olives. Epigallocatechin gallate, EGCG for short, if you can't remember that, from green tea. And you've heard how green tea also is very good for like preventing cancer. So you see, a lot of plant foods can give you a lot of health benefits. And what we're looking at is making your body stronger against any invaders like these viruses. Potential inhibitors of COVID-19, hesperidin, chrysin. I'll talk a little bit about these in a few minutes. Of course, basic things like vitamin B2, riboflavin. I think a lot of you might be taking vitamin C by now, is to boost your immune system. Glutathione is one of the main antioxidants in your body. Also helps to detox through the liver. Andrographis, and then violets, is you see in the picture right there. So you can find a lot of these things in supplements. Hesperidin is a flavonoid that comes from the citrus fruit. Maybe you can eat more of the citrus fruits, the rind, to get some of these other health benefits. But many times you can get from the vitamin C, where they contain bioflavonoids, including rutin, hesperidin. So when you get your vitamin C, try to look for things that have more than just only vitamin C. Chrysin is another nutrient that comes from the honey, passion flower, and has been shown to be very, very good for your health, including reduction of inflammation. Andrographis is an Indian echinacea. You've heard of echinacea as one of the plants that boost the immune system. These can be also found with supplements, and andrographis has been shown to help with the lung health and with immunity. And quercetin, probably this one you can get quite easily in your diet with onions, eating onions all the time, peppers, green tea, etc. So again, many times you can find these flavonoids with the vitamin C that you purchase. So there's a lot more, but we don't really have much time today in this presentation. So my parting recommendations is, if you're diabetic, you have still good news. If you control your glucose, if you can improve your hemoglobin A1C, that's most important. Number two is to lose excess weight, because you're gonna lose the insulin, reduce the insulin, which is a risk factor. Consuming more fruits and vegetables that are high in antioxidants and anti-inflammatories. And to support your immune system with plant foods. And of course, the basic supplements for your immune system is vitamin D3, Most people today are very low in D3, vitamin C, zinc, and plenty of other types of nutrients that can boost your immune system. So I want to thank you for giving me this chance to present to you. So stay healthy. Thank you very much.
Thank you very much, Dr. Keith Horinouchi. So a lot of us during this pandemic have been collecting or buying plants, but most of those we buy are the ornamental. So we need to start up on planting something for our health, as shown by Dr. Keith. So now let's go to the questions and answers. There was a question about, I think this will be answered by Dr. Horinouchi, about coconut oil. Is it good or bad for frying?
Yes. I've been talking about this on Guam for decades now. Yes, coconut oil is good for you. It's for me, it's one of the best oils to use for cooking. And as we saw about the fats, the ones to really stay away from is too much vegetable fats. So coconut oil can be a replacement for that. And there's actually antiviral, antifungal properties of coconut oil as well.
Okay, thank you. There's another question regarding frying. Are the air drying appliances like the air fryer good? What's your opinion about it? Because you don't put oil in those.
Yeah, well, that could be one good way to prepare your foods, but there's actually now more evidence about that we do need to have more fats in our diet, because the membranes of your cells are made up of fats. Your brain is mostly fat. Your brain is 20% cholesterol. So people with dry skin basically usually have low fat in their diet. We just need to have good fats. We don't want to have fats that are burned by over frying or barbecuing. That's my experience all these years in this area, is the preparation and how you use your fats is what causes problems with the oils. So obviously the most healthful oil is when you get it naturally in the whole food, the whole grains, the vegetables. And so I think if you use your oils in the proper way, that's probably more healthy. But using hot air depends on, I guess, what type of food you're cooking. So.
Okay, thank you for that answer. There's another one for Dr. Keith. What's the safe maximum amount of vitamin C supplement for adult per day?
The safe amount is how much your body needs. So what that means is if your body has a lot of free radicals to get rid of, your body needs a lot of antioxidants like vitamin C. And so it really depends on the situation of your health. There's one way of determining that is we call it taking vitamin C up to bowel tolerance. So you slowly increase vitamin C until you start getting more lower bowel gas and maybe loose stools. Then that's the point where you're taking too much vitamin C. So you might get that after 1,000 milligrams. You might get that after 15,000. So it depends on how your body is using it. But I typically recommend between like 1,000 and 3,000 for most people.
Okay, thank you. One more question for you, Dr. Keith. Can ginger be a replacement for turmeric?
No, you probably should have both. There's a lot of benefits for the ginger, a lot of benefits from the turmeric. And of course, they're in the same family of herb. So they're both great for you. And you should try to grow your own. They actually grow very easy.
Yes.
My wife had some and it just grows too.
Okay, thank you.
Okay.
One more question. I think a lot of the questions are for you, Dr. Keith. On taking vitamins, do we still need to take vitamin C if we already are taking multivitamins?
Multivitamins typically only have like 60 milligrams of vitamin C because that's what's considered 100% RDA, a recommended daily allowance. But that 60 milligrams help to stop scurvy. So today we want to take vitamin C to make your skin look good, to have good cartilage, to have a good immune system, to avoid the viruses. So no, you need to take more.
Okay. Do you recommend eating raw vegetables for higher nutrients?
Yeah, that's probably a good philosophy. Depends what kind of vegetable.
Okay,
Some vegetables
thank you.
can be raw.
Yeah. So we're about 10 minutes before 11. I have one more question that Dr. Milay or Dr. Ann can respond to. My son is 400 pounds. If he were to get infected with COVID-19, is this basically a death sentence for him? We still have Milay or Dr. Ann to respond.
I'm here.
Okay.
Just because somebody is weighs a lot, it depends on their fitness level. There's, football players can weigh 400 pounds. So it really depends. But from what we're seeing with the mortality rates on Guam is if half the cases have diabetes, that means about half, more than half have diabetes, more than half are obese. And it's not something that the doctors are tracking, but it's kind of like the 500-pound elephant in the room that nobody wants to talk about. But I can't predict who's going to die, but what we do see is the pattern of people with diabetes. More than half of the deaths are among people with diabetes. So clearly it's a wake-up call. And here's the other thing I didn't mention earlier. What we were seeing in many of the diabetes cases is uncontrolled diabetes, especially with the CHCQM population, that they're not taking their medication. So clearly diabetes management, losing weight, and of course the nutrition, as Dr. I can't pronounce his name, Horinouchi. Yeah.
Dr. H.
Dr. H, obviously it's the same message. It's just like with COVID, we're saying social distance, wear a mask, wash your hands. With diabetes, that's lose weight, eat your vegetables, and exercise. So you can be 400 pounds and be like an athlete if you're fit. So clearly exercise, I think, is one of the big keys. And thank you for the exercises that we had in the with this group.
Thank you, Dr. Ann. That's an awesome response. Okay, we have, I think, here's one more. So many Filipino.
Under the Q&A.
I'm reading that.
There's some questions.
Yes, that's where I'm reading, Aggie. So many Filipino
Okay.
doctors have died from COVID-19. Any ongoing studies about the increased susceptibility of Filipinos to the lethal effects of COVID-19? Do you know any, Dr. Ann, Dr. Kip, or Milay?
I can answer that, Linus. So there's actually a few studies. It's more of what we call it's just data on who among the healthcare workers have been affected or have died from COVID, and it's not just doctors. The study that I read about was healthcare providers in general, and it's majority nurses that had died of COVID. And I am not familiar of any ongoing studies specifically on how susceptible Filipinos are to COVID. And but it's something that would definitely be out there in the near future, knowing that we still learn more about COVID, and that some of these studies will later on be more focused on specific populations. And if we do hear any, I mean, I'm sure the Guam Diabetes Association or the Guam Diabetes Control Coalition would be sharing that as we get more details on, you know, these specific populations that are affected by COVID.
Thank you, Milay. Another question.
Linus, can I add an important comment just to tag on to what Dr. Keith was talking about. He's talking
Go
about
ahead.
nutritious foods. He was talking about nutritious foods and good foods for you, the fresh fruits, fresh vegetables. But I just want to, you know, I've had patients who ask me about this, and then they overdose on, you know, all these citrus on the good starches, you know, the taro and some of the starchy vegetables, the pumpkin, and they say it's good for you, so I'm going to eat a lot of this, and then, you know, their blood sugars go up. So I just want to caution people in this conference now that just because it's good for you doesn't mean you can eat unlimited amounts. Okay, there's still some limits to the amount you eat. Yes, it's good for you and it's better than others, but you still have to watch portion control. That's what I wanted to add.
Thank you, Aggie.
That's all.
One question
Okay.
about blood sugar level. What's the appropriate blood sugar level?
So that depends on if a person has diabetes or does not have diabetes. So for a person without diabetes or who has pre-diabetes, you want your sugar level to be within normal, which is between 80 to 100. But if you have diabetes, it's typically individualized. So talk to your primary care provider on what is your target sugar, because oftentimes we want our sugar to be based on the A1C level, the hemoglobin A1C. So you want it, you know, less than 6.4. And some people would have different responses to medications. If you drop their sugar to normal levels, but it's giving them so many side effects, or they're having more frequent low blood sugar symptoms, then it probably would have to be adjusted differently. Again, it's individualizing the treatment, and but for some, I mean, getting their sugars to the normal level would be more appropriate. Then your provider will try to get your sugar to that target level. So bottom line, talk to your provider on what would be your target sugar level, especially if you have diabetes.
Thank you, Milay. Dr. Keith, do you recommend boiling fresh oregano leaves, and what are the benefits?
I don't really have much information on that, but I know in some of our therapies for digestion problems with microbes, we do use oregano oil. So, but I'm not familiar with the fresh oregano. Probably that's good.
Okay, thank you. Okay, we have a question from Bernie. If I have diabetes and COVID, what should I do immediately?
So first, call your doctor, or from the time you have been notified that you have COVID. So it will be, again, an individualized approach. Like, what is the severity of your COVID? Are you considered mild, moderate, or severe? And so mild, you may have all those symptoms and not necessarily needing, say, hospitalization or going to emergency room. And your doctor will advise you on what to do next. And so it can either be, one would be how you can isolate yourself from other people or other members of your household so that they don't get infected by COVID. And then the second one would be, if you have symptoms, you can be managed symptomatically. And then the third would be, if you develop any worsening symptoms, what can you do? So that's either you call back your doctor or you go to the emergency room to get appropriate care. But again, the first thing you should do is talk to your doctor on what will be your next step, depending again on your the severity of your illness.
Okay, Thank you, Milay. There's one question. I think actually this was the first question. Can diabetes be reversed and how? Who would like to respond to that?
Yes, you can. It depends what the root cause of the diabetes is. And of course, we all think about the food first, which is probably related to a lot of people. So there could be some nutrient deficiencies for the insulin not working well. But in many cases, diabetes is caused by stress, hormone imbalances, toxins. We live in a very toxic world today, heavy metals. And then there's some genetic factors. There's what I've seen in my practice, there's a lot of people here on Guam that have what we call genetic SNPs, or a mutation where certain nutrients are harder to absorb. So they need to actually increase that nutrient or a different form, and then the metabolism can work better. So there's so many reasons why people have diabetes. It's not so simple, but it can be reversed.
Okay, thank you. This is for you, Dr. Keith, again. Are there any preferences in the type of vitamin C, such as sodium ascorbate versus ascorbic acid?
Yeah, there's a lot of vitamin C's out there, and I would say that they're probably all pretty effective. It's very difficult to mess up on a vitamin C. But some people may be sensitive to the acidity of some vitamin C. So in that case, we use like buffered type of vitamin C, like glycinate and things like that.
Okay. This will be the last question because we're already top of the hour. Any difference? Oh, that's actually two. Is magnesium and vitamin D useful to increase immunity?
Definitely vitamin D is related to the immune system. So that's like one of the basics for boosting the immune system, especially if it's low, which a lot of people are low. But you need to have your doctor check your vitamin D level, because too much vitamin D can be toxic because it's a fat-soluble vitamin, so your body will store it. Magnesium is a basic nutrient that's involved with so many things, and yeah, indirectly, it probably can help with your immune system as well.
Okay, thank you, Doc. So this is the final one. I know there's a lot of questions and a lot of it is for Dr. Keith. So you can go to his clinic. Any difference with vitamin B12 chewables and pills for those with hypertension? Or any difference between chewables and pills with any vitamins?
Well, with like vitamin B12, there's different forms of B12. And so sometimes cyanocobalamin, which is the basic vitamin B12, some people cannot absorb that. So you need to have the methylcobalamin. Some people have stress. Some people have a poor digestive system, and they cannot absorb vitamin B12 in their stomach. So this is why some people should try to get the B12 sublingually or just through the mucosa of the mouth. And some doctors can give B12 shots if they're low in B12.
Okay, thank you. Thank you very much to all our presenters and to Aggie for giving us some of your opinions. Now let's go to the polling questions, okay? So there are 4. At the beginning, Mila talked about telehealth. So we have 4 questions here that please respond. Have you used telehealth during this public health emergency, yes or no? If yes, would you use telehealth? If no, would you be willing to try telehealth? And the last question is, based on your experience during today, would you attend a virtual conference in the future? It's just responding to yes or no. So now we're showing responses. So 29 is still going up. So let's give a few more seconds. Okay. Some are still answering. 9, 10. I think we're good with this. So have you used telehealth with your doctor or your primary care provider during this pandemic? 30% said yes, 70% no. Would you like to use telehealth? Again, 78% yes, 22% no. If no, if you haven't used telehealth, would you be willing to try? 93%. And the last one is, what was the last one? Virtual conference. Of course, 100%. Thank you all for your responses on these polling questions. Okay. Now we would like to so once again, the recording will be, you can access the recording. It will be sent via your email along with the certificate of attendance or participation. And there will be evaluation also. You can complete it right after this conference, or you can do that later. It will go into your email inbox. So we appreciate your time and feedback. And I'd like to give special appreciation to the Diabetes Virtual Conference Planning Committee, Agnes White, Kathy Castro, Patrick Lucis from Public Health, Winnie Butler, who's the Executive Director of GDA, and yours truly, Glynis. And special thanks to our Mountain Pacific Quality Health staff who really help us with the technical issues. Mary Erickson, Caitlin Conway, Mary Argonis, who is our admin, Beth Brown, Katie Evanson, and Maynette Wong. Thank you from the bottom of our hearts. And all the participants or the presenters, you will get a goodie bag from GDA. It will be special delivery to you by me and Aggie.
Thank you.
GDA will also provide you with a certificate of appreciation for being a presenter and panelist, Ms. Linda Frank, Dr. Kit, Milay, and Dr. Ann. So all of this will be delivered. So from all of us, from the Guam Diabetes Association, Guam Diabetes Control Coalition, Public Health Diabetes Prevention Program, Mountain Pacific Quality Health, a big thank you, Sijus Maasi. We hope to see you all next year, face-to-face, for our diabetes conference. Enjoy your weekend. Happy Thanksgiving. Stay safe and enjoy the holidays. Merry Christmas, everyone. God bless us all.
Thank you.
Thank you, everyone.
Thank you, everyone.